Let's get to the latest COVID news. In the past 24-hour cycle, 14,858 new COVID cases have been recorded. Sadly, 433 more people have died. I'm joined now by Professor Mosa Moshabela, Acting Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu-Natal. Professor, thank you so much for joining us. Let's just crunch those numbers first. If we look at the provincial breakdown, it's over nearly 15,000 nationally, but Gauteng is 4,900, well, actually nearly 5,000. Western Cape, 3,263, KZN, 1,613. Gauteng really seems to be dropping significantly. Is it safe to say we're well and truly over the worst in Gauteng in terms of infections?
Yeah, no, I think absolutely. Greetings, Ali, and to the viewers. I think that just watching the trends for Gauteng for the past 2 weeks up until now, it is certainly promising that Gauteng is now well on its way to sort of recovery, and the numbers have reached what was previously the peak of the second wave and the first wave. And that just tells you how much Gauteng has recovered from the third wave. And that, for me, I think it's something that's encouraging. And also, we know that even in terms of the deaths, Gauteng has also reached a peak. The numbers are still high in terms of deaths, as you indicate. But I think that even nationally, we are seeing some sort of a peak when it comes to the deaths. And also, Western Cape, really, the numbers look like they are becoming quite constant over the past few days. It doesn't look like it's going further than where it's at the moment. And I really hope that it can also start to do a turn down.
One really hopes so. Third, of course, in the list is KwaZulu-Natal with 1,613. It's a lot less than the Western Cape and Gauteng, but this is a province that's been brought to its knees with the unrest. Listening to Dr. Nicholas Chris speaking to Lisizwe Similane earlier, I mean, in terms of the looting of medicines, it's not just about COVID-19, but there's been a real hampering of medical facilities in KwaZulu-Natal. And although, obviously, and it's your province, things are coming back to normal, I would imagine it's still a very worrying time.
Yeah, no, absolutely. We're going to have to wait maybe for another week or so for KZN, for us to really see what the trend is. Because even though, service delivery has improved, I think that a lot of people are still recovering from the trauma itself, and it's hard to tell whether behavior in terms of access to healthcare has improved, or people are still really preoccupied with the immediate aftermaths of what we saw in KwaZulu-Natal. But Sally, I want to say that I think that it is very likely that the numbers and I'm at a risk of speaking too soon here, in KwaZulu-Natal may not necessarily go as high as we fear. I've been watching Eastern Cape because from the second wave, Eastern Cape and KwaZulu-Natal were the two provinces that were largely worst affected. And so the numbers in Eastern Cape are not spiking as I would have expected. They didn't have the same level of disruption that we saw in KwaZulu-Natal, but their numbers are still, ranging, kind of staying below 1,000, and I'm wondering whether this may be the benefit of some sort, in disguise also, of having, seen the West in the second wave and now benefiting from some sort of a community, sort of broad immunity of some sort. And we're trying to figure that out to say, what is it? Why are the numbers so low in both Eastern Cape and KZN? If it was only KZN, then I would say that it's probably skewed because we're not getting all the numbers in. But I'm not sure why we should see the low numbers in Eastern Cape as well, if it's not a true reflection of what is happening in these provinces.
I mean, you're right. The Eastern Cape's only on 779 new infections today, and as you say, it didn't have the unrest of KwaZulu-Natal. I suppose the concern with KwaZulu-Natal is whether all those gatherings of people at malls, whether that could lead to super spreader infections. But I suppose we'll just have to wait and see. While we're chatting, my colleague Heidi Jacobs just sent me a tweet. And the tweet says that we've now given at least one dose to, we've now administered 6 million doses across South Africa, which is such incredibly welcome news. We know that yesterday we hit 250,000. There were so many detractors saying it wouldn't happen, but it's happened, which is really very, very encouraging. I wonder if you could talk to us a little bit about some of the issues that came up yesterday when the Health Products Regulatory Authority was before Parliament. And the thing that was very alarming to hear was that 28 people died, I think it was, fairly shortly after receiving a dose of the vaccine in South Africa. And I ask you this because it's exactly the sort of thing that can create huge alarm, and it's such a polarized issue, whether you're pro or anti-vaccines. It really shouldn't be, because we know that vaccines save lives all the time. But I wonder if you could talk to us about those 28 deaths, because SAHPRA was very open that they're going to look into them. There's absolutely no sign as yet that there's a definite link between having had the vaccine and then dying, but they are still looking into it. Tell us more.
No, thank you for that question, Sally. I think firstly I should also congratulate South Africa for hitting 1 million in 4 days. That's incredible. And starting to average on 250,000 every day, it's really incredible. It's really worth commending. I did watch the presentation by SAHPRA to the Parliamentary Committee on Health, and my takeaway was that broadly speaking, SAHPRA is monitoring the adverse events. There was 1,500 people who submitted the adverse events to SAHPRA Med Safety app. But I think that for some people, they had more adverse events than others. So there was about 3,500 different adverse events that were reported. And SAHPRA is investigating causal relationship between the vaccine and the 28 deaths that were reported for both Pfizer and Johnson & Johnson in relation to the vaccine. But it's important to understand that those deaths are not submitted to say that they have been caused by the vaccine, because the use of the word cause, in as much as it's loose in the public, in medical terms, it's very specific. It denotes a causal relationship, a cause and effect. And right now, I think that what we can say is that these deaths occurred, following vaccination or around vaccination, and therefore have to be investigated. And that means that all deaths that may happen, or any serious disease that may happen around the time of the vaccination, they must all be reported to SAHPRA for investigation as to whether there was a causal relationship with the vaccine or not. And once those investigations have been completed, we will get the information. What we are hearing at the moment is that a lot of people who present with those symptoms, with those who report deaths, have had COVID-19 symptoms. And they may have, for example, caught COVID-19 before they were vaccinated. They may have caught it at the site. They may have caught it afterwards. They may have had exposure in the family and so forth. And also, I think that it's important people understand that they must not vaccinate at the time when they have just had COVID or they're having COVID with the hope that it will boost the immune system. They just need to wait for care to happen. So the investigations will have to happen. But most importantly, Sally, I think we need to encourage people to report these incidents, and also for health to come forward in terms of what mechanisms are going to be put in place when it comes to the compensation fund when causality is identified. Again, let's stress that these are very rare events. We've immunized 6 million, we've given 6 million doses in South Africa. We now currently have 28 deaths reported in relation to vaccine incidents, and they need to be investigated. But it does not necessarily mean that there is causality, and we need others if there are incidents that people suspect to report. through their healthcare
Yeah,
workers.
and I think that the transparency is absolutely critical at this point to avoid this polarization that we see sometimes developing. Also at that briefing yesterday, and I have to ask you, it's such a hot potato issue, is the issue of ivermectin. SAPRA is insisting there's just not enough evidence, but I know people who swear blind. There are doctors who swear blind it makes a difference. Where do you stand on this one?
Yeah, so I think for me, I understand, the desperation of having COVID-19 and not having a medical solution, a biomedical solution, is frustrating. We've seen it with other things. We saw it even with HIV in the past and other conditions. I get it. I get the desperation and the frustration. I get the need for people to want to have a solution to treat it. But we don't have it. We don't have something that can be given that is effective to a person who's got COVID-19. COVID-19 is a virus. It's not like your bacteria or your fungus or parasite, where these sort of antivirals can easily be discovered. So I do think that let's understand that when someone has got COVID, we really largely have oxygen to assist when there's a need for oxygen. And we might have some sort of dexamethasone treatment to try and reduce any sort of flare-up of immune system whenever they hit that moment where we need to control it. But we don't have much. It's mostly supportive treatment. And to now be desperate for a solution, I understand where people are coming from, but it's also not good practice. That's why SAPRA does not want to take any responsibility. We don't have the evidence for it. It's not there. And so all of it really, it's still, anecdotal. And yes, we are now increasingly getting people reporting that it's creating a false sense of security. People take ivermectin thinking that they're going to be fine. By the time they present to hospital, they're seriously ill. And it becomes difficult to now assist them at that point. So let's just make sure that, we understand the situation that we are in and not force things. I don't necessarily want to undermine, people who swear by ivermectin, but, they need to do it at the risk of knowing that we don't have the evidence to support it.
Yeah, very wise words. Thank you so much for chatting to us this evening. Always such a pleasure. Professor Mosa Moshabela, Acting Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu-Natal. Well,